So we are going to look into the article why the priority should be to reopen primary schools. At least 6 states in India has reopened schools in mid-August. And if you look at those states, you can see that they have opened up classes for secondary school students. And actually the ICMR recommendation is to open classes for primary and middle school students. So why have states acted against the ICMR recommendations? First thing is scientific evidence is not what is used for decision making. Second thing is policymakers go by assumption that older children are more likely to follow COVID appropriate behavior. And the last point to note down is that there is fear and apprehension among parents that younger children may be at higher risk. So these are some of the reasons why which the schools are acting against the ICMR recommendations. So why is ICMR recommending the reopening of primary schools first? Let's look at the relative risks in taking such a decision. So based on Indian as well as global data, you can see that adults have almost 15 times higher risk of death and severe disease compared with children below 18 years. And not only that, even susceptibility to infection is lower in younger children. 15 contact tracing studies indicate that children and adolescents have lower susceptibility to SARS-CoV-2 infection than adults. So basically, the chance of a severe disease in children is very low, as well as the chance of getting an infection is also very low in children. Especially the lower susceptibility is confined to children younger than 10 to 14 years of age. So that brings us to the next point, J-shaped curve. So if you plot a graph of age against the severity of disease, then you can see that it will follow a J-shaped curve, where the base of the J are 10-year-old students who are at the lowest risk among all age groups, and the risk increases as the age increases. Children aged 6 to 14 years are the age group in the primary and upper primary schools from the base of the J and have the lowest risk of COVID-19. So among many other reasons, this is why primary schools must be the first to resume classes. The fourth survey of ICMR also indicate that seroprevalence in children was comparable to adults. So seroprevalence basically shows how many of the individuals have formed resistance towards the virus. So among children aged 16 to 17 years, it was about 60%, while unvaccinated adults had 62% seropositivity. You have to note that this is a national average and some states does not have this value. For example, in Kerala, the seroprevalence is lower than 50%, which shows that the number of people who have been infected by the disease is lower. And independent sero surveys undertaken in a few cities have also found seropositivity around 75% for children. Dr. Gautam Menon, co-author of COVID-19 modeling studies, also say that there should be no major impact of opening schools and colleges in terms of setting up a large second wave, although cases will rise. So there can be a rise in disease, but it will not cause a second or third wave. Now we come to the next point, transmitting the virus. So even though the children may not suffer from serious illness, they are very likely to spread the virus to adults, especially people who are 60 years or older and those having other serious illnesses which are very vulnerable to severe disease and even death. So this brings back the focus to targeted vaccination of teachers and non-teaching staff at schools and parents and family members of school-going children. So if you have a plan to reopen the schools, then priority vaccination should be done to these category of people. Basically, this is a plan for providing a protective ring around children, so reducing their risk of getting infected and spreading the infection to adults. States like Tamil Nadu and Karnataka had started vaccinating teachers on priority some time back. The next point is role of testing. The author is not in favor of mass testing in schools. The article says that knowing the fact that children do get infected and do not develop severe disease, it is not very clear what purpose it would serve. The priority should be given on COVID-appropriate behavior, like wearing masks and social distancing. The other recommendations given are increased ventilation, reduced crowding by limiting the number of students in a class, increased physical distancing, reduced mixing of different cohorts, which means people from different areas should not be mixed together. And last point is more outdoor activity. So all of this can further reduce the risk of virus spread. And the last point is, in nearly all countries, reporting of a case or a few cases in the schools does not mean school shutdown. So the author is saying that there will be some infections, but it does not mean that the school should shut down because the infection may not be severe for the students. So this has been an interesting article. The students are losing out on a very productive and essential part of their growth. These are people who will lead the world in the next 20 or 30 years, and not giving them proper education and experiences can prove costly. I hope you could follow the article with me. Stay safe and see you again.